Ankle sprains are the most common sports-related injury in the United States, accounting for an estimated 2 million injuries a year, according to Chief Editor of Medscape.com, Douglas A. Reeves, MD. If you have ever suffered from a sprained ankle, you understand the pain and probably want to avoid it. Having my ankles taped numerous times and collecting information from the International Journal of Sports Physical Therapy, published in 2012, I am here to tell you a technique you can use as a preventative to the pain or as support for an already injured ankle. After watching this video, you will know what materials are needed to tape an ankle, the steps to tape an ankle, and what not to do while taping an ankle. Before we jump right into taping the ankle, there are a few things you will need. Foam underwrap or pre-wrap, 38mm athletic tape, and scissors or strong teeth. But whatever you do, please do not hurt your teeth trying to rip the tape. Another thing to do before starting is to position the foot at a 90-degree angle, as shown on the left. While taping, you do not want the foot pointed, as shown on the right. Now that you have the correct supplies and positioning, you can start the taping process. The first step is to take the foam underwrap and cover the surface of the foot and the ankle that will be taped. Wrap from the arch of the foot to the start of the calf muscle so that it looks like the picture shown. This step is purely for comfort, ensuring that when you remove the tape, it does not take your skin with it. Technique of this step is not crucial since the foam wrap is for comfort and not for support. Now that the skin is protected, you can place the anchors. These pieces of tape act as a starting and stopping point for other pieces of tape. To make the anchors, wrap 3 separate pieces of tape all the way around the ankle. As you can see in the picture, you place the first piece of tape where you ended wrapping the foam underwrap. The next pieces of tape are called stirrups. Place these starting at the anchors on one side of the ankle, down around the bottom of the foot, and back up to the anchor on the other side. As shown by the yellow pieces of tape in the picture, you will need to repeat this 2 more times. These are arguably the most crucial pieces of tape, according to physical therapist Mike Walden of sportsinjuryclinic.net, so make sure to pull tight. The next pieces of tape are the horseshoes. Horseshoes add strength to the stirrups that you just placed. The action of adding these is similar to that of the anchors, but they are below the anchors and on top of the stirrups. Wrap 3 pieces of tape around the ankle so that they resemble the blue pieces in the picture. This next step, called the heel lock, is more complicated. Follow the numbers and arrows on the teal tape in the picture with one continuous piece of tape. Start on the inside of the ankle on an angle towards the bottom of the heel, shown by number 1. Bring the tape up on the outside of the heel towards the rear of the heel, shown by number 2. Allow the tape to then come back to the front of the ankle on the inside of the joint, shown by number 3. Bring the tape back towards the rear of the ankle on the outside of the joint, shown by number 4. Pull the tape down the inside of the heel towards the bottom of the foot, shown by number 5. Finish the strip by bringing the tape from the bottom of the foot up the outside of the ankle to where you started with number 1, shown by number 6. Repeat the step 2 more times. The final taping step is called the closing strips. It ensures the previous pieces of tape are held in and secured. As shown by the purple, you wrap the arch of the foot and the ankle again. Similar to the heel locks, this can be done with one continuous piece of tape rather than separate pieces. Now that you have finished the completing step, you should know what you need to tape an ankle, the steps to tape an ankle, and what not to do when taping an ankle in case you ever hurt yourself or you want to take a precautionary measure to avoid the pain.